Hernia manifestations, visible bulge or swelling, worse with coughing or straining, pain or discomfort at sight, strangulation signs, severe pain, abdominal distension, nausea, vomiting, fever, tachycardia, surgical emergency. Diagnosis, physical examination, herniography with contrast, CT scan or MRI to locate and assess involvement. Hemorrhoids manifestations, 40% asymptomatic, internal painless bright red bleeding during BM, external, itching, irritation, rectal pain. Prolapse, hemorrhoid protrudes, may need manual reduction, grade 3-4. Diagnosis, digital rectal examination, anoscopy, sigmoidoscopy to evaluate internal hemorrhoids or rule out other causes. HAC irritable bowel syndrome, IBS, manifestations, abdominal pain, often LLQ, bloating, gas, distension, diarrhea, constipation, or alternating pattern, IBSM, pain worse after eating, relieved by defecation, mucus in stool, no fever or bleeding, distinguishes from IBD. Diagnosis, Rome 4 criteria, recurrent abdominal pain 1 day a week for 3 months, plus 2 or more, improvement with defecation, onset with change in stool frequency, onset with change in stool form, appearance, diagnosis of exclusion after ruling out other causes via colonoscopy, labs, imaging. Inflammatory bowel disease, IBD, includes Crohn's disease and ulcerative colitis. Manifestations, Crohn's, chronic diarrhea, non-bloody, cramping, RLQ pain, weight loss, malnutrition, mouth ulcers, fistulas, anal lesions. Ulcerative colitis, frequent bloody diarrhea with mucus pus, LLQ cramping, urgency, tenesmus, feeling of incomplete evacuation, fatigue, fever, weight loss. Diagnosis, colonoscopy, differentiates Crohn's versus UC, sigmoidoscopy, barium enema, to assess disease extent. Stool studies, to rule out infection, assess blood, CBC, ESR, CRP, elevated inflammation markers. Hasher celiac disease manifestations, steatorrhea, foul-smelling, light-colored, frothy stools, chronic diarrhea or bloating, flatulence, abdominal pain, weight loss, fatigue, weakness, peripheral neuropathy, vitamin deficiency, anemia, osteoporosis. Diagnosis, blood tests, anti-tissue transglutaminase antibody, anti-TTG, most sensitive, anti-gliadin antibodies, genetic testing, HLA-DQ2, HLA-Q8, intestinal biopsy, confirms villus atrophy. Diverticulitis, manifestations, LLQ abdominal pain, most common, fever, chills, nausea, vomiting, abdominal bloating, distension, constipation or diarrhea, leukocytosis, tender palpable mass possible. Diagnosis, abdominal x-ray, initial test to rule out free air perforation, CT scan with contrast, confirm diagnosis, identify abscess or perforation, no barium enema during acute inflammation, risk rupture, CBC, WBC count. SHAC appendicitis, manifestations, initial periumbilical pain, localizes to RLQ, McBurney's point. Rebound tenderness, guarding, rigidity, low-grade fever, nausea, vomiting, anorexia. Rovsing's sign, LLQ palpation causes RLQ pain. Pain relief followed by worsening equals possible rupture. Diagnosis, clinical presentation, ultrasound, initial, CT scan, definitive, CBC, WBC, left shift. Colorectal cancer manifestations, change in bowel habits, diarrhea, constipation, blood in stool, occult or visible. Narrow, ribbon-like stools, unexplained anemia, weight loss, fatigue, weakness, abdominal distension or palpable mass advanced. Diagnosis, colonoscopy with biopsy, gold standard, fecal occult blood test, FOBT or FIT, CT MRI for staging, CEA, carcinoembryonic antigen, tumor marker. Abdominal trauma manifestations, rigid, board-like abdomen, pain, tenderness, guarding or rebound tenderness, signs of shock, hypotension, tachycardia, cool clammy skin, nausea, vomiting, ecchymosis, Gray-Turner's sign, Cullen's sign. Diagnosis, focused abdominal sonography for trauma fast, CT scan if stable, diagnostic peritoneal lavage if internal bleeding suspected, CBC, HH for bleeding, electrolytes urinalysis.